Hello friends, today we are discussing age estimation report. Now this slide shows the medico legal importance of the age. Age plays a significant role in both civil and criminal cases, leading to disputes regarding age eligibility. For instance, in India, individuals above the age of 18 are tried in session courts as adults and receive appropriate punishments. Conversely, those under 18 are tried in juvenile justice courts, resulting in the lesser penalties. So, one can produce the fake certificates which is showing age less than 18 years. Similarly, in civil cases, eligibility for certain roles, such as standing in election, requires individuals to be over 21 years old. The age report is an important and compulsory question worth 10 marks in your practical examination. We will provide you with an exercise to prepare a hypothetical age report for individuals aged 6 years, 10 years, 14 years, 16 years, and 18 years. Since we cannot provide a separate patient for each student to estimate the age, you will need to imagine a candidate of a specific age and write a report based on their physical examination, secondary sexual characteristics, dental examination, and the conclusion of age within the given range. So, you should have the knowledge of radiological finding, dental examination, physical examination, and secondary sexual characters of these age groups so that you can accurately write the age report. This is the age report format in your journal. It encompasses the three parts. Part A is the preliminary examination. Part B is the clinical examination in which physical development, height and weight column is there. Also for the secondary sexual characters. Now part C contains the dental examination, and in part D there is the radiological examination, and there is final conclusion in which the age should be given in the range and the sign of the doctor. The age report format in your journal encompasses both physical, dental, along with radiological assessment. During the physical examination, part B, it's crucial to document height, weight, secondary sexual characteristics, and for females, details regarding menarche and the date of last menstrual period. This examination is vital as it yields significant insights into the individual's age and may indicate the necessity for the specific X-rays. Now in part B, there is a specific part for the secondary sexual characters. In this, Tanner staging helps assess the developmental stages. The provided image illustrates the breast development and corresponding ages, showing that the breast development typically surpasses the areola around 12 years, with distinct mounts of the areola and nipple forming by 13 years. Adult breast development occurs 15 to 60 years. So, we can give the Tanner staging according these developments like the B1, B2, B3, B4 and B5. Furthermore, the presence and distribution of pubic hair can also serve as a general age indicator. At age 12, there is an absence of pubic hair, while between 14 to 16 years, pubic hair does not reach the inner thighs, which is the characteristics of the adult development. Similarly, in male genital development, there are no rugosities present at the testes before 10 years of age. Rugation starts at 11 years and the glans develops at the age of 15 years. Now we will move to the part C, that is the dental examination. Why dental examination? Because in all the races there is the number and the types of the teeth are the same. Also, age of the appearance of teeth is universally the same in all the human races. There are total 20 temporary teeth and 32 permanent teeth. Now you can see in this image It is the image of lower mandible. The teeth in the inner circle are the temporary teeth, and the teeth in the outer circle are the permanent teeth. So you can easily see that the permanent teeth are more than the temporary teeth. The teeth highlighted in red in the image represent the 6 to 8 teeth in each quadrant, which are permanent and referred to as molar 1, molar 2, and molar 3. Each eruption of these molars contribute 4 additional teeth to overall count, classified as supra-added teeth, since they do not replace any temporary teeth. This characteristic allows for age estimation based on the total number of teeth present. For example, the first permanent molar emerges around age 6, raising the total from 20 to 24 teeth. Therefore, if a child has 24 teeth, they are likely over 6 years old. The second permanent molar appears at the age of 12 years, increasing the count to 28 teeth, indicating that a child with 28 teeth is probably older than 12 years. The third permanent molar typically erupts between age 17 to 25 years, resulting in total of 32 teeth, suggesting that a person with 32 teeth is likely older than 17 years. Thus, by just assessing the number of teeth, one can infer an individual's age. Now, teeth highlighted in the yellow are the temporary teeth, which are first to the fifth in each quadrant. Now, from the age 6 to 11, these teeth replaced by the permanent teeth annually, means each year each type of teeth is replaced by the another permanent teeth. So, this phase in which there are both the teeth are present in the mouth, they are permanent and temporary, both the teeth are present in the mouth, and these years is called the period of the mixed dentition, which is from the age 6 years to 11 years. Now, each quadrant of the temporary teeth has the total number of 5 temporary teeth. They are named the central incisor, then lateral incisor, canine, first temporary molar, and secondary molar. In contrast, each quadrant of the permanent dentition consists of 8 teeth, with 5 retaining the same names as their primary counterparts, as teeth are typically named based on their function. The remaining 3 teeth are identified as the premolar 1, premolar 2, and molar 3. So in this image, you can see the blue arrows. So temporary molar 1 and temporary molar 2 are replaced by the permanent premolar 1 and premolar 2. So by name, we can consider only premolar 1, premolar 2, and as there is no temporary molar 3, so only molar 3. These teeth, premolar 1, premolar 2, and molar 3 are by name you can identify as a permanent teeth. Other teeth, by the name, you cannot identify whether they are permanent or temporary. That's why to distinguish between these teeth, a two-digit coding system is utilized in the dental charting. So we will learn about the dental charting. And you have to fill the cells in the C section of the dental examination with this dental charting. So as you can see in the upper hand side, there is dental charting for the permanent teeth, and on lower there is the dental charting for the temporary teeth. Now in both these cases, the first digit denotes the type of tooth and the quadrant in which the teeth is present, while the second digit specifies the tooth its place in the cell. For example, 54 numbered teeth, number 5 denotes temporary teeth in the right upper quadrant. Number 4 denotes its fourth from the center, which is temporary first molar. Similarly, 44 number teeth. So, number 1 denotes the permanent teeth in the left lower quadrant. Number 4 denotes its fourth from the center, which is the temporary first premolar. Similarly, 44 number teeth, in which digit number first, which is 4, which denotes that it is the teeth in the left lower quadrant and it is a permanent teeth. Also, the second digit, which is also 4, in which the number 4 denotes it is the fourth from the center, which is the temporary, which is the permanent first premolar. So that quadrants are denoted by the number 1, 2, 3, and 4 in case of the permanent teeth. So if the first digit is any of these 1, 2, 3, or 4, then it signifies the quadrants and also they are permanent teeth. Similarly, in cases of temporary teeth, the quadrants are denoted as 5, 6, 7, and 8. So if any teeth, any tooth which has the digit 5, first digit 5, 6, 7, or 8, it is a temporary teeth. Similarly, if any tooth which is denoted by a number in which digit first digit is any of the 1, 2, 3, or 4, it is the permanent teeth. Memorizing the age at which this temporary teeth erupts is straightforward. Now, for temporary teeth, simply recall the multiplication table of 6. For the lower quadrant, note the multiplication table and write down 6, 12, 18, 24. This number represents the months at which the temporary teeth emerge, starting from the central incisor to the lateral incisor, canine, and second molar. The first molar typically appears around the 14 months. It's an exception. Now, to determine the age for the upper central incisor, simply add 2 to the number 6. It gives the 8 months. And then add another 2 to find that the upper lateral incisor appears at 10 months. In similar manner, for permanent teeth, one can simply refer to the multiplication table of 6. At age 6, the first molar appears, followed by second molar at age 12, and third molar around age 18. This serves as a mnemonic for easier recall. The third molar teeth typically emerges between the age of 17 to 25 years. These are the supraadult teeth. Now, if you plot the numbers 7, 8, 9, and 10 at these ages, central incisor, lateral incisor, first premolar, and second premolar will replace their respective temporary teeth in the socket. The canine tooth is exception in the permanent teeth, which lastly replaces the temporary tooth around the age of 11 years. These teeth, central incisor up to the second premolar, are referred to as successional teeth because they replace the temporary ones. It is important to note that temporary molars are replaced by the premolars. Now, this is how the dental chart will look like at the age of 6 months. You are able to see two teeth in the lower quadrant. The first digit of which is showing 7 and 8, which suggests that they are in the lower quadrant and also they are temporary teeth. Second digit 1, which suggests that this teeth is first from the central, which is central incisors, and as the number 7 and 8 denotes they are temporary, these are the temporary lower central incisors. Now, at the age of 8 months, upper central incisors appear. At the age of 10 months, upper temporary lateral incisor appears. At the age of 12 months, lower lateral incisor appears. Up to 12 months, two teeth appears at the same time. But here onwards, the four teeth will appear at the same time. At the age of 14 months, permanent temporary first molar will appear. All four temporary molars will appear at the same time. At the age of 18 months, temporary canines appear. At the age of 24 months, temporary molar second appears. This makes the count of total number of teeth is 20. From 24 months, that is 2 years, 2 up to 6 years, the total number of the count will remain 20. Here in the red columns you can able to see that 4 teeth are appeared, which are permanent molar first, and they are numbered as 16, 26, 36 and 46. The first digit denotes that they are the permanent teeth and also their respective quadrants. Second digit suggests they are sixth from the center, which is the permanent molar 1. If you count the total number of teeth at this point, they are increased to 24. As the number increases from 20 to 24, these are called super added teeth. Now each time a super added teeth will added, then number will be increased by the 4. Also here you are able to see the temporary molar 1 and permanent molar 1 at the same time, but they are differentiated like this. The first digit of the molar 1 permanent is 1 and molar 1 temporary is 5, and second digit of permanent molar 1 is 6, that denotes its position from the center, which is 6, and position second digit of the temporary molar is the 4, which denotes its position from the center, which is 4th. Now from here onwards, the permanent and temporary teeth will be present at the same time from the 6 years to 11 years, and this is called the age of the mixed dentition. Now at the age of 7 years, the 4 central incisors will appear, which are permanent. They are shown in the green columns. You can able to distinguish that total number of teeth is not increased, as temporary central incisors are replaced by the permanent central incisors. As they replaces already present teeth, does not increase the number, they are called as the successional teeth. At the age of 8 years, lateral incisors will appear. Again, they are in the green column and they replaces the temporary teeth, they are called the successional teeth. Now something interesting will happen at the age of 9 years. At the age of 9 years, the permanent temporary molar 1 are replaced by the premolar 1. So here the name is changed. The temporary molar 1s and temporary molar 2 are replaced by the premolar 1 and premolar 2 respectively. Always remember, premolar are the permanent teeth, not the temporary teeth. All students get confused as the name premolar. They think that the premolars are temporary teeth, but never get confused. Premolars are always the permanent teeth, and as they do not increase the number, they are successional teeth. At the age of 10 years, molar temporary molar 2 are replaced by the premolar 2. At the age of 11 years, the last temporary teeth which is replaced is the canine, which is replaced by the same name permanent teeth. Now you can see all the teeth are permanent, and hence this age range between 6 to 11 years is called as the period of the mixed dentition. During this mixed dentition, you can able to distinguish between the temporary teeth and permanent teeth by two ways. One, the morphological difference, like the color of the teeth. The temporary teeth are more whiter than the permanent teeth, and also by the x-ray. In the x-ray, you can easily see the teeth which are yet to be replaced by the permanent teeth. You can see the teeth underneath that. At the age of 12 years, second permanent molar will appear. Now you can easily see that the total number of teeth is increased from 24 to 28. As the total number of teeth are increased, it is super added teeth. At the age of 17 to 21 years, third molar appeared, and which is increases the number by 28 to 32, and that's why it is super added teeth. During the period of mixed dentition, if you want to check whether the teeth are temporary or permanent, there are two methods. One is the morphological methods, in which by other morphological findings like the temporary teeth are more lighter or more whiter than the permanent teeth and other morphological findings, and by X-ray. Now you can see in this X-ray the tooth which is marked by the white arrow. So this teeth is yet to be appeared, but it is visible in the X-ray. So the teeth below which there is the teeth which is yet to be appeared, they are the temporary teeth. So in this way you can identify during the mixed dentition that whether the teeth is permanent or temporary. As we studied the teeth eruption age and how it is used to calculate age, similarly, radiographical examination is utilized for the same purpose. In every long bone, the metaphysis and diaphysis, that is proximal end and distal end, fuse at a fixed age range. This process starts with the appearance of secondary ossification centers, which appear at fixed age range, and ends with the fusion of these ossification centers at the distal end. Carpals are an exception to this, as they do not fuse to each other and remain unfused. So carpal bones only appear but do not fuse. At the age of 9 years, the last carpal bone appears, which is the pisiform, making 8 carpals in the wrist X-ray. Similarly, at the age of 14 to 16 years, all the ossification centers around the elbow joint are fused. And at the age of 18 to 19 years, all the ossification centers around the wrist joint are fused. At the age of 21 years, all the ossification centers around the pelvic bones are used. We calculate the probable age based on examination in Part B and Part C and dental examination, and then suggest X-rays of the elbow, wrist with hand, and PBH. By combining all these three findings, we deduce the age. In this slide, the yellow square indicates a gap between the olecranon process and the ulna in the left X-ray, which means it is not fused. In the right X-ray, shown in the red, there is no gap, indicating the fusion. The olecranon process ossification center appears at the age of 9 years and fuse between the ages 14 to 16 years. The person in the left X-ray is more than 9 years old and less than 16 years old, and the person in the right X-ray is older than 16 years. See, these are the ossification centers around the elbow joint you should know. These are the ossification centers on the lower end of the humerus around elbow joint, in which capitulum, medial epicondyle, trochlea, and lateral epicondyle is there. Capitulum appears at the age of 1 year, medial epicondyle at the age of 5 years, trochlea at the age of 10 years, lateral epicondyle at the age of 11 years, and they all fuses between the age of 14 to 16 years. So in a 10 years old of the child, you can have the finding like capitulum is fused, medial epicondyle is fused, trochlea is appeared but not fused, and lateral epicondyle also appeared, lateral epicondyle not appeared, means the person is 10 to 14 years of the age. These are the ossification centers of the radius and ulna bone in elbow X-ray. Now around the wrist. See, on the left hand side, on the right X-ray, in the green bracket, the lower end of the radius and ulna appear to be fused, and in yellow circle, the first metacarpal bone is lower end of the first metacarpal bone is appeared and fused. On the left hand X-ray, in the red square, the lower end of the radius and ulna, both they are not they are appeared but not fused, as there is a gap, and also base of the first metacarpal is appeared but not fused. Lower end of the radius and ulna appears at the age of 2 and 5 years respectively, and fuses at the age of 18 to 19 years and 17 to 18 years. Also the base of the first metacarpal fuses at the age of 15 to 17 years. So from this X-ray, the age range can vary from the 5 to 6 years to 17 to 18 years. So to reduce this gap, we have to check the physical examination, secondary sexual characters, dental examination, and also the X-rays from the other joints. This is the age of appearance of the carpal bones. Remember, carpal bones only appears, not fuses. Now, hip bone. These are the different uh, different ossification centers around the hip joints. Triradiate cartilage, iliac crust, ischial tuberosity, pubis symphysis, and lesser trochanter is there. Means if the age of your in your exercise is more than 16 to 17 years, hip X-ray must be there. If it is less than 14 years or 12 years, only elbow joint and wrist joint is more than sufficient. So, in conclusion, we have to take all the findings of section A, section B, dental examination, and section C, radiographical examination. From each of these can help to reduce the gap between the range in which we are giving the opinion. This is the format for the 10 years old examination. Here you can see all the columns A, B, and C field. You are able to see mixed dentition as there are teeth with the different first digit are present. Here you can see the radiological examination. You have to arrange all these in this tabular format and clearly mention the age of the second ossification center, whether it is appeared and it is fused or not fused, all this in the detail. Also, you can able to see the conclusion, which is age given in the ranges by the final conclusion, which is deduced from A, B, C, and D. Thank you.